Your search for unbeatable internet speeds is over. Visit Docomo Pacific today and sign up for as low as $60 a month so you can experience our fast, reliable internet speeds for yourself. Docomo Pacific, better together.
Good morning, everyone. We are at the Horiguchi building, and we'll explain why in a minute, but we're joined with the Commonwealth Medicaid Agency's George Cruz. Mr. Cruz, thanks so much for joining us, and so we just wanted to check in with you given some of the changes at the CNMI Medicaid Agency. But first, I know you entered the role in December. It's about 10 months in.
Yes.
And you were previously at Mariana's Health. And
correct.
So for our audience who might be meeting you for the first time, just do you mind explaining your background and your transition over to Medicaid?
Sure. So again, my name is George Cruz. I'm the new director for the Commonwealth Medicaid Agency. And so I started in December 10th of last year. And at the call and the request of the late Governor Arnold Palacios to come in and see if we can help update and change Medicaid. And so for the past 10 months, even with all the challenges and things like that, we've done such an amazing job. And so we just wanted to take care of a lot of internal things first before we came out publicly to share with the community what's been going on, how we're changing, how we're trying to improve our services, not just for our beneficiaries, but also for our providers as well. So I've come from a background, I've been the former administrator and chief executive officer for Mariana's Health for about 24, almost 24 years at that time. I retired from Mariana's Health, and so just like I was sharing with you offline, the Gov called me, the late Governor called me and asked if I could come in and help with Medicaid. And of course, that's one of the things I always believe in, teach my kids and others that I work with is if you ever have an opportunity to give back to the community, in whatever capacity, I always encourage people to do that. And so that's the same for myself. So that's why I'm here today to share about some of the amazing progress that we've done with the CMA. There's still a lot more to go. We're not done yet. And so, yeah, we're just here to share about a lot of those successes.
Great, and I know one of the main topics is your location.
Yes.
So tell us about where you're moving, how services are continuing with your relocation.
So we're very happy to say that we've moved about, I'd say 80% of our services here to the Horiguchi building. For those who don't know where the Horiguchi building is, the former federal court, right next to Cristo Rey Church in Garapan, right across from the fishing basin. And so we're on the second and third floor. And so for our beneficiaries or our clients who are applying for Medicaid or are renewing their Medicaid applications, they can come and visit us on the second floor. For our providers, they're able to visit our compliance and our claims department on the third floor. And so we're just really happy because previously at our old building, for those who've ever been there up in Capitol Hill, it was so much smaller, very congested for parking, and just for our staff as well. So here we have parking across the street at Cristo Rey. We have parking around the building, and so we're very happy about that. The place is very professional, to not just for our staff as well, but also for the clients that we're going to be serving, right? So it's a lot more comfortable and more spacious. They're not congested. They're not fighting over parking like they were. And for those who are beneficiaries who visited our CMA office in Capitol Hill know exactly what we mean by that. Sometimes you're driving around in circles trying to find parking. So, we wanted to prevent a lot of that. And so we're just very happy to be here. Also to know that our hours have changed, and I think this is a huge thing. So previously at our building in Capitol Hill, we were open only from 7:30 to 1 o'clock, Monday through Thursday. Now we're going to be open Monday through Thursday, 8:30 till 4 o'clock here in Saipan. Our Rhoda and our Tinian branch are still open from 8:30 to 4:30, and of course closed during lunchtime, or we're going to be open during lunch and then just stagger our lunch hours in Rhoda and Tinian because we only have one staff each there. But And then Fridays here will still be closed for walk-ins, and that's just because things are still done manually with our agency. So we still have to do our due diligence to make sure we do our phone calls, our follow-ups, our verifications. And so we typically get anywhere from 75 to 100 people per day for our applications, so that can stack up very fast. And so, so we're just very happy to share that with our community. Again, we're open Monday through Thursday, 8:30 to 4 o'clock.
Right.
Yeah.
And location is important. I'm looking at your website. It says at least for FY24, you have over 18,000 beneficiaries. So.
Yes, actually that's updated. We're a little bit over 19,000 now. So when you look at that, we're actually servicing about 47% of the total population for the CNMI. So another reason for our move here is because with the austerities, as you know, we're anticipating that to increase. Because with whatever austerities from each of the different agencies such as PSS, the court, legislature, and especially the central government, even the 10 hours will now increase the number of people who may qualify for Medicaid. And I say may, right, because that just because the hours decrease doesn't also mean that you may qualify, but there is a possibility, right, depending on other situations and criteria. But so with that, we're anticipating anywhere from 2,000 to 3,000 individuals, including the private sector. So if that increases, Tomas, we're going to go from 19,000 to about 21 to 22,000 individuals, which is now more than half of our CNMI population that we're going to be serving.
And you're anticipating that in the next fiscal year?
This fiscal year. Yeah.
As in by the end?
Yes. You know, as the austerity, all the austerity measures kick in.
Months.
Yeah.
All right. Thanks for the updates. Are you guys impacted at all, other than hours, in terms of funding, even with the federal government shutdown and then the local cuts? What are you projecting, or any anticipated reduction beyond hours?
Right now, no. We're really trying to do our best to, with the staff that we have. We've actually also worked with WIA a lot to get a lot of our frontline staff. And so that's actually one of the other things I've been working on since I came on board, was working with our manpower. As you know, right, manpower is very crucial in regards to processing. And you know, you probably have heard, and we continue to hear this in the community, that, you know, it takes forever at Medicaid. And so we're trying to change that story. And so one of the things when I first came into Medicaid, we had about 17, 18 personnel. That's very little when you're dealing with 19,000 beneficiaries.
Half
exactly.
Yeah.
And so that was one of the several things that I was working on, was to increase our manpower. And so as of today, we're about double the amount of personnel that we used to have when I first came in. And we put a lot of those personnel in our eligibility, which is working with our beneficiaries to process applications faster. Another was in our claim side to get reimbursements out to providers, because we were 2-3 years behind in payments. And so, you know, and I'm very glad to say that we've pretty much, in our claims team, we've caught up from 2023 and 2024. And so we're now dealing with a lot of reimbursements for the current, from last fiscal year, which we're almost closed out with as well.
Do you have a dollar amount for that?
So yes, we actually were able to reimburse last fiscal year of over $120 million. And so one of my goals that I shared with, of course, the late governor, and also Governor now Apatang, was that my goal is to focus a lot of our reimbursements on our local providers. And the reason being is, if we can make sure that we provide sufficient and consistent payments to our providers here on island, the goal is for them to grow and expand. And that just benefits our patients better, right? Our beneficiaries, that now they have better access to dental care, to primary care, to other, diagnostics, et cetera, pharmacy, right? And so that's always been my goal, to come in and is to definitely help our beneficiaries, but also our providers, because they need it. Again, as a former provider, for 20-some years, I knew how it was to really almost 40% of our revenue was covered by other services, right? Because it took 6 months or sometimes a year to get paid by Medicaid. And so there's only so long that a business can sustain that. And so now we're hoping to see more growth over the next year. So we actually beat my goal. My goal was 60% for local funds to stay on island, 40% for off island. From last fiscal year, we did 67%. So that means out of the $120 million that we were able to process, about 80 million were able to stay on island, right? We paid out the hospital. The hospital got also a huge bulk of that, which was about maybe close to $60 million. And then the additional 20-some million was for other providers, from dental to pharmacy to home care to outpatient rehab, et cetera.
And so the delay in payment is because of the federal funding?
No, the delay in payment was because of lack of manpower.
Okay.
Yeah, and a lack of a system in place. That means everything, like I said earlier, everything was still done manually. Yeah. And so our goal, we're working with procurement and other agencies, CMS, especially our federal partners, to get a system in place so that, one, it affects our beneficiaries better. They can now apply online versus having to come all the way here as well, right? They can check their status online via an app, et cetera. And then also for our providers, now they can put in their claims electronically. So right now, they have to come here. Even our off-island providers, they send cases of claims to us, on a weekly basis. So we average about 3,000 claims a day. And so again, at that time, we only had 3 claims providers, right? People processing claims. So we were always behind. Any given day, we were always behind. So now we have about 6 to 8 staffing claims. And so this is the reason why we're able to process more and we're processing a little quicker. Are we out of the woods yet? No. But we're getting there. I mean, this has only happened in 10 months, right? And so just think what happens if we have a full fiscal year or another year, 2 years. We'll get a lot of these systems in place. Things will be a lot more smoother for our providers, but also our beneficiaries. They'll be able to get their cards online, right? Rather than having to wait in the mail to get their blue card for insurance. So our goal is to get things as quickly as possible for both our beneficiaries and our providers. But it's going to take time. And so I ask the community, our providers and beneficiaries for patience on that. Now you asked the question about how does the federal shutdown. The great thing about it is Medicaid's funding is not part of the overall federal budget. It's a separate bill. And so that's already been passed. And if anything, this year with the territories and most specifically with the CNMI, we actually had about a 2.5 to 2.7 bump or increase in our funding. So that's a great thing. I really believe that Trump and HHS, Health and Human Services, they're really looking at the states, because those are billions and billions of dollars, versus the territories, where we're really, it's a lot of money for us, but it's a drop in the bucket for the overall bigger picture. So we haven't been affected in any cuts, and so knock on wood and on that, but we're really excited about that. The only thing that again we really want to bring attention to is, because this is something that I had to learn myself and also had to now relay this to a lot of our providers, especially off-island, is we've never been fully matched locally, right? So as you know, the federal match is 83%, the local match is 17%. What that means is out of every dollar that we spend, that we pay for reimbursements, the federal government pays 83 cents and the CNMI government pays 17. And so there's never been a time that we've actually been fully funded. And so this goes for for fiscal year as well. And so, but we do what we can to stretch out our funding. And so one of the ways that we wanted to do that is because we spend a lot. We spent, like I said, over $40 million on off-island care. Is that important? Yes. But if there's ways that we can prevent that from happening and reduce that, right? And so just focusing on more on prevention and things like that, that's kind of my focus also in the bigger picture. And so if you recall the SOCA, where the late governor mentioned about committing $5 million a year to prevention, we're still in track with that, right? And again, with this bump that the federal government gave us, this 2.5 to 2.7, that's going to help us in regards to achieving that goal. And so if we can at least focus some of our efforts in regards to Medicaid into prevention, we feel that over the years, hopefully in shorter period of time, but definitely in the longer term, we'll reduce our overall healthcare costs, right? Because to prevent someone going into dialysis, that's kidney failure, which is typically caused from diabetes, right? Uncontrolled diabetes. So if we can help control, diabetes, and pre-diabetes, then we can control our costs overall with dialysis, right? Because dialysis, the cost for one person now has gone up. About 10 years ago, it was about maybe about $98,000 to care for one person in dialysis for a year. That's almost doubled that, over 10 years. So, but then prevention efforts have stayed stagnant, right? They actually, if anything. And so that's where I really feel, again, coming in from the private sector, but also just being involved in the community. My whole life I've been involved in the community here from DYS to PSS and everything. And so it's just making sure that our community stays healthy. We've seen, we're gathering a lot of stats, even though a lot of this is manual. But just to give you some quick statistics, between fiscal years 22, 23, and 24, we spent over $14 million in oral cancer care off island, right? But that's for 48 people. So that's about $289,000 that we spent in care for an individual per year in each of those years, right? But if we focus a little bit more, or even half of that, or even a quarter of that amount of $289,000 on prevention, like CCA, they have, we're supporting their labeling for the betel nut packaging, right? Just things like that. If we can continue to educate and have, people think about, their health, moving forward, hopefully we can reduce oral cancer right here in the CNMI. Because not only that, and I've had many family, I had a few family members that I was very close to who have, died to oral cancer, and they were young, 20s and 30s. And, this is happening. This is real in our community. And so that's just one, physical activity and all of these things. So we're really, looking forward to supporting the NCD coalition, the Non-Communicable Disease Coalition, and other, the sports associations, because again, we really want to focus a lot of our efforts on prevention. And definitely in our adults, but we need to also start young, right, with the kids.
All right, Mr. Cruz, thanks so much. Appreciate it.
Thank you.
Your search for unbeatable internet speeds is over. Visit Docomo Pacific today and sign up for as low as $60 a month, so you can experience our fast, reliable internet speeds for yourself. Docomo Pacific, better together.